Hello, I'm Steve Ramakers. I work for the Boise BLM Smoke Jumpers, and I'm detailed here at the Office of Aviation Services as a training specialist. I'm here today to present to you the Aviation Operation Checklist. The Department of Interior Aviation Safety and Aircraft Mishap Prevention is based on the philosophy that all aircraft mishaps can be prevented, and that mishap prevention is an inherent function of any position. How is our philosophy achievable? Isn't there always going to be inherent risks with all aviation operations? Looking at this graph, we can clearly see our accident rate on a downward trend since the establishment of OAS. So we ask, how can we improve our already successful aviation program? And how can we empower everyone within our program to decrease our mishap rate? While attempting to answer these questions, OAS discovered a powerful example of a medical checklist being utilized by the World Health Organization. Atul Gawande is the author of the Checklist Manifesto, which is the book referenced to begin the development of the Aviation Operation Checklist. Atul was interested in addressing the question, how do professionals deal with the increasing complexity of the responsibility? Atul teamed up with the World Health Organization to solve the problem of increasing volumes of unsafe surgeries worldwide. Finding a way to reduce surgical harm in every operating room in the world with more than 2,500 different surgical procedures seemed impossible. Working with a group of surgeons, anesthesiologists, nurses, and patients from around the world, they came up with a surgical checklist that could produce measurable, inexpensive results while reducing overall complications from surgeries worldwide. In the spring of 2008, 8 hospitals from around the world began implementing the 2-minute, 19-step surgical checklist. Results showed that rate of major complications from surgical patients in all 8 hospitals fell by 36%, deaths fell by 47%, infections by 49% after the introduction of the checklist. Of the overall 4,000 patients in the study, 435 would have been expected to develop serious complications, but instead just 277 did, while sparing 27 of them from death. So again we ask, how can we improve our already successful aviation program, and how can we empower all of our users to even further decrease our mishap rate? Here's what we're using today. These tools were developed for users in the field to promote aviation safety. OAS worked collaboratively with the Bureau's subject matter experts to develop an additional tool that overcomes failures by building on experience and past mishaps while taking into account our human inadequacies. Here is our Aviation Operation Checklist. Aviation operations have an inherent risk. The Aviation Operation Checklist is a tool allowing users not to rely on memory, but standard format to be completed for every mission, incorporating all individuals involved. The Aviation Operation Checklist is segregated into 3 sections. Each section is followed by designated individuals that should be included in completing all checks. The first section consists of pre-operation planning. The pre-operation planning checks are due confirmed actions that should have been completed well in advance of the mission by the project aviation manager and flight or helicopter manager. The aviation management plan, project aviation safety plan, and mishap response plan must be approved, signed, and current. Project Aviation Manager must approve the risk assessment and verify all crew members are in compliance with training requirements and that aviation life support equipment will be utilized. The next section of the Aviation Operation Checklist is the Operation Briefing and Pre-Flight Plan. The Operation Briefing and Pre-Flight Plan checks are redo actions that are completed the day of the mission by the manager and pilot. This section is designed to give everyone involved in the mission the same awareness of what potential issues are. The last section of the Aviation Operation Checklist is the During Operation Checks. During Operation section of the checklist includes the last critical steps for a safe flight. This is now the time that all personnel must remain vigilant and not become complacent with flight following, PPE, and awareness of flight hazards. During operations is when all personnel should come together as a team, and if you see anything out of the norm, say something. We have developed the Aviation Operations Checklist with the hopes of having the same dramatic results as the Surgical Safety Checklist, which was ultimately used to save lives. This checklist will ultimately empower all users to identify weaknesses and continually challenge the processes. A safe flight is a result of careful pre-operation planning, operation briefing, pre-flight plan, and a during operation procedures. Remember, everyone plays a part in aviation safety.